Carefully inspect your framework. The framework should follow the prescribed design. It should fit the cast without rocking. All rests must be completely seated in their rest seats. The framework should be polished. The framework will have appropriate finish lines. The tissue stop will be touching the cast. There will be adequate space provided for the acrylic resin base material. Carefully place the framework in the patient's simulation. Once complete seating of the partial is verified, examine the patient's simulation occlusion. Using articulating paper shim, ensure that the patient's simulation can obtain the maximum intercuspal position previously established. If the patient's simulation cannot fully close, mark the area of interference with articulating paper. Carefully relieve the metal framework until the patient's simulation can achieve maximum intercuspation. Under no circumstances should you adjust the teeth on your patient simulation. The rests are seated. The framework does not rock. The patient simulation can close into maximum intercuspation. The framework fits the master cast. The framework fits the patient's simulation. You have an accurate opposing diagnostic cast. Once this has been verified, you are now ready to outline the base area on your master cast. Outline the area of the proposed record base on your master cast as seen in the diagram. Vaseline the areas of interest on your master cast. Place the framework on the master cast. You are now ready to construct a trial record base using the triad material. It is important to avoid fully investing the ladder mesh with triad because its eventual removal will be difficult. Place the triad as seen in the illustration. Trim the triad to the pencil line that you have previously drawn. In areas where there is a finish line, terminate the triad at the finish line. When the triad has been suitably formed, place Vaseline on the surface of the triad. Light cure the triad for 5 minutes. Remove the record base and framework from the cast. Check the base for sharp areas. The borders should be rounded and not be overextended. You may adjust the trial record base with the acrylic burr. It is only necessary that there be no sharp edges on the record base material. Construct an occlusal record base from pink base plate wax using a tongue blade to simulate the occlusal plane, as seen in the illustration. Insert the record base and wax rim into the patient's simulation. Reduce the pink base plate wax until it does not touch the opposing occlusion. You should have room for approximately 2 millimeters of alu wax. If there is interference with the triad base must be relieved in the area of interference. After you have verified clearance, place Vaseline on the maxillary patient simulation. Uniformly soften the alu wax and close the patient's simulation into maximum intercuspation. Immediately retrieve the framework and chill the alu wax. Trim excess alu wax from the buccal and occlusal, leaving only indentations of cuss tips. Replace the framework on the patient simulation and verify maximum intercuspation. Place the framework and occlusal registration on your master cast. Verify that the maxillary and mandibular casts are accurately articulated. Use an arbor band to make keyways in the mandibular cast base. Lubricate the keyways of the mandibular master cast with Vaseline. Lock the condylar elements. Secure the maxillary and mandibular casts together. Check for space between the lower member and the mandibular cast. The black line on the incisal pin is flush with the upper member of the articulator. Mount the mandibular master cast to the existing maxillary diagnostic cast. The incisal pin is touching the guide table. Please remember laboratory safety, protective eyewear, turn off all Bunsen burners when finished. Be careful when working with the lathe with hair, fingers, and the workpiece. It is not anticipated that this exercise will be difficult.